We have been working on a case study to understand the use of evaluation evidence in interventions to address violence against women and children. I have been doing the interviews with different policymakers, with civil society organizations, with think tanks to understand the way that research is generated in this sector and how it's used and how it has influenced policy and what we can learn from that and try and understand whether that actually makes the policy better and what are the factors that influence the whether or not the research evidence is being taken into consideration.
There was a high level of violence against women and children in the country. It was around 2011 and 12. So the first thing that the president did to respond to the challenges of gender-based violence was to establish a structure called IMC. What it means is that all the cluster ministers that are mandated to deal with issues of gender-based violence in the country were nominated to serve on that structure. It consists of 6 departments. The first one, it has our department, DSD. The second one, it was all the law enforcement agencies like Justice, SAPS, NPA, Health and Education. The convener, it was our Minister, Social Development. They were tasked with the responsibility of getting to understand what is it that makes our country to be so violent to our vulnerable groups. And thereafter, understanding what are the challenges, then come up with interventions. Immediately what that structure did was to commission a study called the root cause of violence against women and children, to understand what is it that makes people to engage in violence.
So when we made that submission as part of the National Evaluation Plan, it was then considered for this work to be done. The advantage of that is that that gets to be addressed at the cabinet level because the evaluation plans are approved by cabinet.
At that time, I was working at the Department of Planning, Monitoring and Evaluation. And around 2013, we got involved with the evaluation to try and understand why, despite the many investment that government felt it had made, levels of violence against women and children were still quite high. We started working with the Department of Social Development and the IMC to try and craft out what the TORs will be and to evaluate government's intervention in the sector. It did focus on the entirety of government departments that are meant to respond to violence against women and children, and then to try and see what in the value chain was not working. So we looked at budgets, we looked at policies, legislation, we looked at institutions, we looked at the relationship between government and civil society organizations. The evaluation was done between 2014 and about 2016 we concluded it. After it was done, the group of departments came together, developed an improvement plan. That plan was taken to cabinet.
It's also good to highlight the good practices from DPME as the lead in research space. One of the things was that, with the research that they've done, it led to evidence-based program. Out of that process, an improvement plan was developed. And the improvement plan was actually taking all those recommendations that came out of those studies, and it was actually actualizing them, ensuring that they are alive, they are there, they are documented, and they demand the sector to respond to them. It was approved at Cabinet, which is the highest body. and the DPME had a mechanism to actually hold us accountable as a sector. Every quarter they will send requests, they will send a report, they would demand a progress. That was a good practice for me to say we have managed to utilize the research. Half of the time good studies are conducted and they end up being just good studies, they gather dust. They are never given an opportunity to be implemented.
There is a very strong role played by the Department of Planning, Monitoring and Evaluation, a very strong knowledge brokering role. That means getting the evidence out, translating it into different messages that are easy to understand, making sure that it's presented, making sure that people have access to the information. Platforms that are created by other people. At the time that the evaluation was done, Save the Children, ISS and UNICEF had established a national dialogue on evidence-based programs for violence against children, and that became an important platform with that research. That process led to the program of action on violence against women and children. And that was the first kind of policy program plan that tried to bring together different programs, policies from different departments into one strategy, and with a specific focus on violence against women and children.
And as we speak now, South Africa is busy preparing a national strategic plan for GBV. And in that process, again, you can still see the diagnostic review being referenced, in terms of what it recommended must happen. And then also the increase of budgets by National Treasury for the Department of Social Development, which was a combination of the recommendations from the diagnostic review, the lobbying that was still happening from civil society organizations and some of the members of the Violence Prevention Forum.
Within the M&E space, for us, it's about that responsibility. Make sure that you collect evidence, you look at the performance, and make sure that you use it to inform decision and strengthen this effort that government is making and all other stakeholders so that it broadens their scope and understanding.
For me, that project, it also brought a new thinking, fresh ideas. At least that whatever they do is going to be discussed at a higher level, which is cabinet, and it also goes lower because with the NGOs that we're working with on the ground, there were changes that we've proposed and they were also appreciating those changes. So you could see that at least what you are doing, as much as it looks like it's policy, but it manifests at a lower level in terms of changing the people's life.
There's a lot of knowledge that's generated. It's sometimes in the public domain, sometimes it's locked up in journals, but it doesn't quite fit with what the policy space requires to make decisions. What we're seeing from the research is how there's quite a liberal view that comes through in our legislation, in our constitution, and also in research, and a lot of research. But that seems to be contrary to values that public servants seems to hold, and we saw it both in the evaluation itself and now also in the in their research, and that makes it quite difficult for some of the research to be taken on board into a policy process. Make sure that nurses, social workers that are working on the ground with women and children are part of conversations, are part of framing the research agenda, but also hearing and understanding the research that's coming out and seeing how that helps them to respond better to real life situations, and not just limiting it to conversations about the kind of national high-level policies.
Well, one is about management. We had to manage a variety of players and government departments because there were police, there's justice, there's so forth. So to manage multiple players coming from, they all have different mandates. It becomes a challenge because the response and reaction and how we manage as a country violence against women and children is done through various departments. But one other element as well, which is key, which is more of a widespread societal phenomenon, is the whole notion of the patriarchy that still persists. Even when it comes to the employees of government, they still harbor some of this patriarchal attitude.
I think violence against women and children, it's, even though we talk about it as a sector, it has no kind of strict boundaries that says this is where it begins and this is where it ends. And so there's many people who come at it from very different angles. And so trying to gather the evidence, even doing the interviews, was also quite challenging because who are the voices who should be included and excluded from a project that has such tight timelines? They've got their interest, and sometimes that research interest is pursued without necessarily due consideration about what the policy space requires and needs. And that came out quite strongly with, for example, some of our Treasury respondents saying, we need to understand the cost of delivering things before we can make decisions about taking on new research. There's issues about relationships within the sector between researchers and government. They affect not just the research uptake, but they also affect how we work together collaboratively in interventions, in designing interventions, in taking things forward, in policy discussions. And also I think just because people are aware of the research does not necessarily mean that they will act on it with the spirit that was in the recommendation, because there are resource constraints, and some of the recommendations require a whole configuration of how the state works with civil society, how the state provides services.
The main gains was for us to realize all our contributions, the fact that we need to have these concerted efforts to respond better, and also to look for better funding, and because it unearthed some of those particular issues that we had. But also it assisted in terms of establishing a broader stakeholder that will be able to provide oversight, better coordination, and a clear understanding of these institutional arrangements, and everyone knows their role for us to be able to respond to these particular elements.
Consultation is quite critical because one of the negatives about the plan was that there was no wider consultation. So we learned that consultation in every process, even if the product can be right, can be good, but it is important to consult so that there can be a buy-in at that level. The other lessons learned is that there are consequences if people are not implementing what they are expected to implement. Because, for instance, the leadership was aware that certain people are expected to do this, and if they're not doing it, they will be writing letters, they will be demanding explanations. So it was sort of promoting that accountability.
To have research from different perspectives, but it's also equally important to make sure that that research is accessible. That means it's readable, people can understand it. The last lesson, and is probably very specific to the sector that we're looking at, it's finding research processes that allow for the voices of people who are studied to come through. Because often, as researchers, you go into communities, we collect data, we make sense of it, we present it, and often become the spokespeople on behalf of women and children. And we don't create spaces for them to speak for themselves. And I don't think it's impossible to have research that's still empirical, that is still rigorous, but that at the same time is done in such a way that it's not exclusionary. It does not reinforce the power imbalances in society.
For me, I was happy that, we always talk about the programs must be evidence-based, but we don't really take that seriously. With this project, it ensured that really evidence is literally translated into actions. It did not only end as a research paper or findings, but it find expression in what we do in terms of the programs that we had. There are a number of programs that we started doing which were recommended by the research, and we knew that they are working because that's what the research is saying. And some of the things that the research said that is not working, we began to relook at that and said, oh, okay, for 5 years we've been running this project, and the research is telling us that it's not working. No matter how much we love that project, but if it's not going to give us the desired outcome, why should we continue with it?
But I just think that developing that knowledge base of research usage, research uptake, why do things get uptaken or not, is quite important for the research community. I think in a sector like this, we definitely need a lot more spaces that facilitate dialogue between different parties. And so I think one of the things that is important in thinking about evidence use is thinking about how do you create such spaces to be mechanisms for change, spaces where there can be deep democratic processes that allows for different voices to be heard and to be mediated, and hopefully find some common ways that we talk about the problem and find solutions together.